All right, and we'll open the Wakefield Board of Health meeting today, July 21st at 7:06 p.m. And myself, Candace Linehan, and Laurel Gorville.
Orville here. So we're open.
All right.
Okay, Maureen, do you want to approve your minutes? I believe you people got them from your last minute meeting.
Yeah, do you want to open it to public comment first, or do you want to approve the minutes?
Yeah, you can. Go ahead.
Shall we, somebody want to make a motion to open the Board of Health to public comment?
Motion to open Board of Health comment, public comments.
Second that.
All in favor? Aye.
Aye.
Panchero, aye.
So we'll open it. Is there anyone in the public that wants to speak? I have no.
I see no one present.
Doesn't
So-
look like anyone's here. Yeah.
Can we make a motion to close the public comment?
Make a motion to close the public comment for the Melrose Board of Health meeting.
Second that.
All in favor? Aye.
Aye.
Panchero, aye.
So the public comment is closed. So the next thing would be to approve the minutes from the meeting. I think it was June 8th or 9th.
Yeah.
Questions or comments on the minutes?
I think they look good. I didn't see anything. Make a motion to accept the minutes from the June 8th meeting for the Melrose Board of Health.
Second
I'll
that.
second. All in favor? John Pay, aye.
Panchero,
Lisette, aye.
Okay, so Elaine,
Wakefield, do you want to open yours up just in
No.
case there's any public comment there?
Yep, so let's open up the Wakefield Board of Health meeting to public comment. Anybody on for public participation or comment?
So seeing none, we already spoke to the one person who's on, and she is just here to observe. So I believe we can close the public participation part of the meeting.
So 7:09, we'll close the public participation part of our meeting.
And then I would make a motion to amend. So I have the June 14th. Thank you very much. Thank goodness for a really big phone. My only thought is I'm not sure. No, I don't. It's fine. It's just that we in the heading of the minutes, it has Candace Linehan vice chair, but when we call the meeting to order, we've got Candace rightfully as chair. So I would recommend that we just change the positioning of our titles. Elaine Silva remains health director. Candace Linehan should be titled as chair. Doesn't matter what Laurel Gorville, whether you want me to.
Secretary,
Okay, anything else, Laura?
No, everything else, everything looks perfect. Well done.
I think my name was spelled wrong in there.
Yeah, where?
There's only one N in Candace usually. It was spelled Candance, which is a pretty common error. Not of high
Do it
importance.
again, Cindy.
Yeah, not of high importance. Yeah. Right. So why don't I take a motion to accept the minutes?
I make the motion to accept the minutes as amended.
All right, I can second that. All in
I
favor?
I am in favor. Aye.
Aye. Thank you.
I know. I do apologize, everyone, for having to drag you out in the summer, but I have a reputation for that. Something came up in regards to tobacco that Maureen ran into and we ran into with recent inspections. With COVID, you know, everything was so upside down that some things were changed, some things were new, things went into effect, and they kind of went not by the wayside. We knew kind of, but we didn't. And I'm going to have Maureen, and this is why I called this meeting tonight. And I want Maureen to explain this to you. And I want you as two boards to understand what has happened. Maureen, it's yours.
Okay, thanks a lot. Thanks, everyone. I'm going to apologize in advance for my exaggerated lisp tonight. I have Invisalign braces, and it is causing more of a lisp than even usual. So I know. And yes, I am my dentist's oldest patient with Invisalign.
Oh.
But anyway, so as I think, well, actually, there's some new board members, so you may not be as aware of the changes in tobacco law that have happened recently. So maybe I'll just back up a minute and remind everyone that we have local regulations around tobacco regs, and then we have some state laws that we also enforce. And in December of 2019, the governor signed into law some new tobacco legislation, which increased the legal age to buy to 21, prohibited the sale of tobacco products in pharmacies and in educational institutions, well, actually all healthcare institutions and educational institutions, and made vaping equal to smoking, so that anywhere that you couldn't smoke under Massachusetts really good smoke-free workplace law, you also couldn't vape. We actually had those provisions already in place in both Melrose and Wakefield. So fortunately, a lot of local communities, boards of health stepped up, adopted new progressive tobacco legislation, especially around the, because of the vaping problem. And as many communities stepped up, then that caused the state to look at it more closely and take action. That was December 2019. In December 2018. In December of 2019, the state legislature passed another tobacco bill, which was amazing, 2 tobacco bills in 2 consecutive years. And this one was called an Act to Modernize Tobacco Control, and was a very, very, very comprehensive bill. I'm going to review some of the key provisions. I won't even touch the insurance provisions, the benefit provisions, the provider divisions, a really dense, important bill. And a lot of people are aware that that bill included a flavor ban. Some people call it the menthol ban. In Melrose and Wakefield, we already had a flavor restriction. You couldn't buy flavored tobacco products in a family-friendly store. You could only buy them in adult retail stores. But we were following the federal legislation, the federal law around flavored tobacco, and that exempted menthol. So we had menthol cigarettes, menthol chewing tobacco, menthol jewel pod, whatever, in our convenience stores, gas station, mini marts, places where kids may go and do go. So that's what made this state law so important. The state law banned the sale of all flavored products in all retail tobacco stores, including adult-only stores. And the only exception is smoking bars, and it's only for on-premises use. And we don't happen to have any smoking bars in Melrose or Wakefield, so it didn't affect us. Another important piece of that legislation was an increase in fines. Prior to this new law, our local boards of health, most of them, not all of them, but most of them across the state, had a fine structure that was a $100 fine for the first violation of a tobacco regulation or law. Second violation was in a 3-year period. We had a tolling period or probation period or look back period or whatever you want to call it. The second violation in that period would have been a $200 fine and a 7-day suspension of the tobacco permit. A third violation in that 3-year period would have been a $300 fine and a 30-day suspension. The new law increased those fines to $1,000 for the first violation, $2,000 for the second violation, and $5,000 for the third violation. Wow. So a pretty significant increase. Also, for any community that didn't have a tolling period of 36 months, it increased that to, some had a 2-year tolling period. We already had a 3-year tolling period, but anyway,
Wait, Maureen, what did you just say? A what period?
Tolling period, or look
From
back
one to the next?
period, or yep, or probation period, or whatever, however you want to refer to it. Because these fines increased and are no longer what we call 21D tickets, civil violations, Now I don't write tickets for these violations anymore. The health director writes an order to correct. And that order to correct is a letter for, a letter. And in that tells what the violation is and also what the fine is and where they make the fine payable to. The Board of Health in prior to this new law and now may still hear appeals from store owners who are appealing not the fine amount, but are appealing the violation. With these new fines, 1,000, 2,000, 5,000, it's a state law and they can't appeal that to the Board of Health. They can appeal it to Superior Court because it's a state
Wow.
law. But you may have appeals, and I had a couple in Malden the other night from store owners who are appealing the process, the protocol, the actual violation. So was the enforcement done properly? Was the youth buyer trained? Were they supervised? That kind of thing. So you may still hear that, going forward. So those are some of those are probably the big, I don't want to call them the biggest changes, but those were the key changes that we really emphasized in this last year of education to all the store owners. There were some other requirements within the law. One is that anybody selling a vape product now, in addition to the local Board of Health permit, they also have to have a DOR license, Department of Revenue license. In the past, they didn't because DOR wasn't regulating these products and wasn't collecting an excise tax.
Wow.
But under the new law, they collect excise tax on vape products. Therefore, the stores have to have a DOR license so that the DOR knows where to go to get the excise tax collection. So we did have to tell retailers then they now need a DOR license as well. There also was a lot of new signage. Store owners now, if it's a convenience store, gas station, mini mart, what we call a family-friendly store, they actually have to post 7 different signs. There's a summary of the state law. There's the MLSA, the minimum legal sales age sign, 21, flavor ban, e-cigarette warning. They already had to post cigar warning, no smoking, no vaping. And there's one that and the quit line. We require stores to post a prominent sign that gives the number for the quit line. It's a smoking cessation hotline. So we did a lot of that. We did all of that, and all stores had to be visited and given a package of new signs and told where they had to be posted. One thing that I didn't emphasize, and I will in this coming year, but is part of the law, was that in the past, the state law was anyone who looked like they were under the age of 27 had to be carded. So if a customer walked in and in the store owner clerk's judgment, they looked like they were under 27, odd number, I don't know why 27, but anyway, then they had to have their ID checked. In the new state law, all customers must be carded. And that is a huge change.
Yeah.
And I know there will be some angst and pushback because it just takes more time. And these convenience stores are selling lottery tickets and whatever they are. And then a customer comes in, asks for a pack of cigarettes. They look like me or they're 50 years old or whatever, and they've got to card them. So that's a new part of a new provision in the law. Also, another new provision that I didn't, and this is important for tonight's meeting, that I did not emphasize to our store owners was that all sale to minor violations, there are all kinds of violations. A sale of a flavored product is a violation. Not having a required sign posted is a violation. Having tobacco products on the counter within reach of a customer is a violation. So there are lots of violations, but obviously a critical one is sale to a minor. We're trying to keep these products out of the hands of youth because we don't want the youth to start smoking or vaping because it's dangerous, unhealthy, and just too hard to quit. So anyway, under the new law, any sale to a minor violation triggers a suspension. So before we were used to no suspension on the first violation, 7-day on the second violation, and 30 days on the third violation. The new law says other violations do not trigger this, just the sale to minor. Any sale to minor triggers a violation. in the first sale has to be at least a 1-day suspension and not more than 30 days. So that will be something that you will be required to decide anytime there's a violation. Other provisions, every product or every retailer has to have a letter from the manufacturer, at least on corporate letterhead, signed by a corporate officer, stating that any product they sell does not have flavor in it. They also have to have we call it a manufacturer's letter. They also have to have a manufacturer's letter for all vape products attesting to the fact that these vape products do not have more than 35 milligrams per milliliters of nicotine. So in the way that a lot of products are packaged and in the advertising that you see on them says, like, I'll use Juul as an example. Juul has a 3% pod and a 5% pod. Any family-friendly store can only sell the 3% pod, not the 5% pod. An adult-only store can sell higher nicotine products, higher nicotine content products. So an adult store can't sell flavor, but they can sell higher nicotine content like a 5% product. So these are all things that are new to they're new to the retailers, new to the program, a lot of education done around all of these things, except for the two that I mentioned, IDing all customers and that all sales to minors trigger a suspension. Another thing that retailers can't do now, they can't advertise any product that is prohibited by the law. So for instance, after the new law was passed banning flavored products, we'd go into a store, we'd see a lot of menthol signs, Newport signs. A green Newport sign means menthol, so green Newport signs are not allowed. There's a new product on the market called Newport Reds, and a red sign is allowed. So we had to check the signs, get those signs down. Older provisions are still in place. Local Board of Health permit is required. No coupons are allowed. No out-of-package sales. Liquid nicotine containers must be child safe. Humidors must be locked or out of reach of the customer. And the self-service displays, like say a lucite case with Juul pods sitting on top of the counter, must be locked or only accessible in the back by the clerk. So anyway, the big changes that the board, or the reason for this meeting is, one, to let everyone know that fines won't be able to be appealed to the board because now that's a state violation. It'll go to Superior Court, and that you will have to decide on the number of days suspension. Now, because I did compliance checks in all of my communities, the minute I had a fully vaccinated, trained youth, and I finally had one in June, I went out and did compliance checks. So Melrose, Malden, Wakefield, Winchester. Unfortunately, the compliance was not great. The non-compliance rate was worse than we usually see, but we hadn't been doing compliance checks for a year and a half. And, people might've gotten a little slack or, whatever. So in Wakefield, 6 stores sold. 7-Eleven, Easy Sig Vapes, Quick Mart, Wakefield Convenience, and the store that used to be, it's 222 Salem, and I think it was called, I can't remember now, Wakefield something, but Wakefield Variety, used to be called Wakefield Variety. It's a new owner and it's called Salem Variety. It's on Salem Street, called Salem Variety. So 6 stores sold. We decided to waive the violation for Salem Variety because they had been opened exactly 8 days. I didn't realize the new owner had taken over. I had done 0 retailer education with the new owner. So he has been now thoroughly educated and understands any future violation will result in a fine. But so that's what we did with Salem Variety. Easy Sig vapors on Albion and Quick Mart on Lowell and Wakefield Convenience at 4 Elm Street. Those were all second violations. So a second violation would have normally, well, under this new law, would have triggered a $2,000 fine. What we did administratively was decide, now, so it doesn't change the law, but administratively, we decided in view of COVID and in view, I've done a lot of education, and these stores have been touched more than once and had in-person visits. But with all the pressure from COVID and so many new elements to the law, which I just reviewed for you, we decided to not enforce the $2,000 fine. What we did was we waived the look back period. So we didn't look back 3 years. We just said, new year, clean slate, all these new laws, and everybody got a $1,000 fine. They were all educated that a future violation will be a $2,000 fine. But because we did the $1,000 fine and kind of under the old rules, calling it a first violation, we did no suspension. Now, because we hadn't even educated our boards, say nothing about the stores, about that you need to decide the 1 to 30 days suspension for that first violation. So we're trying to make that crystal clear. And I can share with Elaine my notes from tonight. It's just like bullet points, and then it'll just be that quick hit list of the new law. So we want you to be aware, because what's going to happen is a violation will take place. We try to get that order to correct out within the next couple of days. So an order to correct is going to go out to the store, telling them that they had a violation. It's going to be a $1,000 fine, or if these are second violations, or $2,000 fines for the stores that I mentioned. If it's a second violation, that's going to be easy because the new law does say 7-day suspension. So that one you won't have to decide. The ones you're going to have to decide will be not on the fine amount, but on the number of days suspension, the 1 to 30 days for a first violation. If it's a sale to a minor, other violations, you will have to decide that. Laurel, you had a question? Oh, you're muted.
No, I was just using my hand saying that's the one, so I was just clarifying, that's your first offense.
Yep.
Wow.
So the biggest change to you folks, first violation, sale to a minor, the 1 to 30 days, you'll have to decide. The second kind of major thing I think is that because the fines are above a civil penalty and went into a different disposition, it'll be a state appeal. But you may still hear appeals on the process. Somebody may say, I don't think it was fair,
Yeah.
Whatever the most frequent reaction I get when I go in and tell a store that they violated, they'll say the person looked older.
Yeah, well.
Well, with the new law now going forward, we'll do a lot of education around this. They need to card everyone. So it doesn't matter how old. It's not judging whether somebody looks like they're 27 or under. They need to card everybody. And that will be a big change. And, you may hear some complaints from retailers. Maureen.
What about Melrose? How many did we have and who?
Melrose had 2. Oh, sorry. Melrose had 2. West Wyoming Market and Bob's Market. And both of those were second violations. And we did this, I'm sorry, I should have mentioned that more. And we did the same thing in Melrose that we did in Wakefield. We waived the look back. So it's considered first violation, $1,000 fine. And because we hadn't educated as well as I feel we should, we are not doing the 1 to 30 day suspension on that first violation, but we will be going forward. And again, that's something that the board will decide. The number of days will be decided by the board. But the fine will go out and we expect that to be paid.
I have a noisy neighborhood. So as far as these 2 violations for us,
Yep.
they're getting a $1,000 fine.
Yep.
And no suspension of their life.
That's right.
That's
right.
Although this is not their, I kind of think this is like more than their second, if I'm not mistaken.
It could be, but if we did the 3, if we just look back the 3 years.
Mm-hmm.
Yeah.
So what we're really deciding on tonight is going forward, we're not voting on what this was going to happen to these two particular places
Right.
going forward for the rest of,
Yeah, and you'll have to well, actually, that's a good point, Maureen. I was thinking that you would decide on a case-by-case basis. So say I come back to you and I say, say I say Bob's Market sold again. You say, well, they just have a history of this and this, and then maybe they have other food violations and whatever. So as a health board, you look at that store and you decide, they haven't learned the lessons, they've had other violations, late paying for their food permit, whatever, dumpster prop, whatever it might have been. And you may decide a higher violation. Or maybe you don't want to look at it one by one. Maybe as, you two separate boards, maybe you want to say, okay, if they have a second violation under the old law and under the new state law, it's a 7-day suspension. A third violation is a 30-day suspension. You might want to decide that any first violation, and remember, this is just for sales to minors, not all those other violations. Any first sale to minor violation gets a 1-day suspension. And then you wouldn't be meeting on all of these. You would have decided that every first sale to minor violation is a 1-day suspension, and that's what we would do in the letter. You would, if you decide that, that's what we do in the letter.
Between 1 and 30 is as the law.
What did you say, Laurel?
So as a board, so
Yeah.
just building on what you're saying, and by the way, I'm sitting here just admiring your comprehension and teaching of policy. I miss policy. We haven't talked about it in a long time. It's a judgment, whether it's if I'm hearing what you're saying about the state law, it's between 1 and 30, no more than 30 days.
Yes, yeah.
So we could, well, I'm just saying, so we could
Yep.
say, okay, everybody, you're getting a 3-day suspension. Now,
Yep.
in the past, what we've done for these bigger suspensions, which are usually 7, are they 7?
Yes, 7, we've done as
7
much
days.
as 7,
We've
7
always-
business days.
Yes, but yeah, we've always been careful about business days
Yeah.
and
Because it was in your Board of Health regulations.
right,
And now state law supersedes
right,
those unless your local regulations are stricter
Are
than the
stronger.
state. You can be stricter,
I
but
don't-
at least as strict as the state.
okay, so the process then is twofold. So one is each town or each board has the ability to sort of set what that first suspension should be. And we either set it across the board as policy, or we invite all sorts of appeals. And I have a feeling, and we're going to be busy with other things in the fall. So that's one thing. The other is whether we have to rescind what we have on the books now, because they're kind of moot.
So we are, Elaine and I discussed this and thought, one, you weren't even going to meet in the, so this was not the time to have you do a new policy.
Right.
But it probably is a good idea to adopt the state law into your local regs, just so they match up.
Right.
Legally, it's fine. We can do this. That's not an issue, but it's just cleaner if your local regs line up with the state. And I know some boards of health across the state are already looking at doing that.
Yeah. So what I would suggest is that, not tonight, because we need public comment when we're changing these regs, if I remember. I swear to God, this whole year with COVID, I've forgotten how we always do things.
Yeah, we would need a public meeting if we
Right.
change the regs, but tonight you didn't.
Right. And so my
There actually was, our TAs actually did address that. And I mean, it's not a bad idea to have a public meeting with public comment, but we're going to be enforcing the state law. And all you're doing is bringing your regs into line with the state law. You're not making something stricter than the state law already is. So you don't have to, technically, you don't have to have a public hearing for that. If you were
except,
changing if you were
Oh, I see.
changing your regs, like, let's say you didn't like the $1,000, $2,000, $5,000 fine, and you wanted to go to 248, then you would have a public hearing and a comment period, because that was more than what was currently in place. But what is currently in place across the state is the state law.
Okay.
It's just your regs don't line up
If
with that
we-
right now in
However,
every
if
instance.
we fold in a set, so if we decide to
So pick a number.
pick a number, I know.
Yeah.
I know there's a better word. I've lost my good words. So for instance, if we were to adopt or just, just republish, so just say, as of October 1st,
Yeah.
2021, the state regs or, town regs are in line with state regs, with the clarification that the first offense will be an X day suspension and regulate it in that way. And that, I'm not sure if that would it's interesting your point about not having.
Yeah, it fits within the state law because it's 1 to 30.
Right.
But, you might be comfortable having and so the reason I said not necessary on those other things was because if you invite the public
Right.
and have them comment on it, and it's nothing that they can really
nothing they can do, right,
influence,
right.
you've
Yeah.
wasted their time. I think that would be annoying.
Yeah.
If they can influence something you're going to do, then I think it's more fair to have a public hearing with public comment. So in your scenario, Laurel, I think, yeah. We're
We
thinking
did,
about this, and
Maureen we did consult, tobacco control legal about this, because I was on the fence, and the biggest thing was that, these fines are big fines. And then when you look at a suspension, like I said to Maureen, you're talking about, even if you talk about a 5-day suspension, like a $2,000 fine and a 5-day suspension, that could, in some stores, they have to do their 50%. And then, you could be talking about another $4,000 or $5,000 loss to a business. So, we want to help them as much. And all of them that we heard from that came in, I think Cindy can kind of attest to that too. We're very thankful that we were, doing this way and helping them the best and going to. And as Maureen said, it's the education now that we have to go back to redo. And that takes a lot of time,
Yeah.
a lot of time.
I mean, the end goal, let's just, what we're in business for is not annoying people and not
Yeah.
fining them. Our end goal is to reduce risk access, because we know that nicotine is, the most potent neurotransmitter that floats into that brain. And once it's in, it's pretty hard. And so I'm doing more addiction work these days, and I always remind people that nicotine, in fact, is the gateway drug. It's just the reward system.
Yeah.
This really gets going. So that's something you taught us long time ago, Maureen. So, in anything that we do, it's about protecting kids, public health and protecting public health. If we start getting like nutty with invective and vindictive about times, I really think that, there'd be a backlash, and it's just like, well, you're awful. So I'm glad to see, and always have people have seen this, Maureen, that you just do such a good job with education, and then we're working with us, so we didn't get any threatening notes reporting our favorite tobacco control agent, because you do it in such a way. It's a gift.
well, thank you for that, Laurel. A little postscript to all of this is, we did hear several complaints, reports, rumors over the time of COVID that, a parent might say their child was able to get a product at, such and such a store underage, they were able to buy. So we can't enforce anything that I didn't actually observe.
Right.
So it's like, you knew your neighbor was speeding on the highway. Well, no state trooper is giving them a ticket because they didn't observe that behavior. So I can't, but I can go in and I can do extra checks. And what we did in cases like that was we started doing a more aggressive inspection. So normally you'd go in.
You were like underneath the
Yeah,
I'm going,
Yep.
I know there's flavors.
yep, exactly. So if I heard somebody was selling flavor, and then, so I was checking on stores that I heard reports on. And then I felt that I really, and my colleagues as well, we really needed to change our protocol and check on everyone, because there may be people selling this that we're not hearing rumors on. So we have been doing more aggressive checks, checking every bag, bin, shelf, whatever it is behind the counter, everything except purses or personal backpacks that the clerks or store employees might have. And unfortunately, did find stashes of hidden Newport menthol, Crave flavors, spearmint wintergreen chewing tobacco or whatever. So I don't want to say it's proved fruitful, but it's proved necessary to do more intensive inspections when we're out there doing unfortunately, a regular inspection. But
I'm gonna assume
as
that-
Laurel
yeah.
said, we're trying to protect
Yeah.
our youth. And so it's important that we reduce access, and sometimes to reduce access, you really have to enforce the laws that are designed to reduce youth access, like these sale to minor laws.
And New Hampshire's, I'm sure that's where everyone's getting their menthol flavors.
What'd you say, Laura?
I'm imagining that we have quite the go over the state practice of getting those products that are available in other states that are not any longer. Are you hearing
Yeah,
any trends?
Absolutely. There's actually some Nielsen data that I just found out about this week that pretty soon DPH will be doing a public release of, that shows the changes in cigarette sales in New Hampshire, and the huge, I shouldn't laugh, the big increase in menthol cigarette sales in New Hampshire post June 1, 2020, which was the effective date of the flavor ban in Massachusetts. And that's anticipated. We have we're on the border with some of these other states that haven't done it yet. That's why we're really hoping that the federal government is able to do the flavor ban that the FDA is looking at right now, which would include menthol.
Yeah.
They have a flavored cigarette ban, but it exempted menthol. So we're hoping that they have to go through a public commentary period and so on. It's going to be a long slog, but that will help, because then there won't be menthol cigarettes available in Rhode Island and New Hampshire and other states that haven't. Massachusetts, by the way, was, if I didn't mention it, was the first state to do a statewide flavor ban.
Yeah.
Very proud of the Massachusetts legislature for stepping up.
And the reason why menthol is so important, Maureen, I believe you taught us, was that it's an anesthetic.
It's more addictive, and the menthol anesthetizes your throat so that it disguises some of that harsh flavor, and you're actually able to smoke more. Also, there's a racial equity component. We know that big tobacco targeted minority communities, specifically African Americans. I don't remember the number, but I can't even remember. It's so big. I forget if it's 70 or 90% of African Americans who smoke menthol. And that's a much higher rate of menthol smokers than in any other demographic. So and even now, we don't do as much pricing survey as we used to, but when we were doing pricing surveys more regularly and more products, I would find lower menthol, say Newport menthol, which is the biggest seller in Massachusetts. I would find lower prices for Newport menthol in Malden than in Melrose. Difference in demographics. So thanks for that question, Laura. That's very important, that that the reason behind our aggressive approach to flavored products. And as far as other flavors like the vape products, I'm sure you all read that Juul just settled with the state of North Carolina. I can't remember how many gazillion dollars they settled for their practice of marketing to young people with their flavored products. Maura Healy from Massachusetts also has sued Juul. We haven't settled yet, but eventually we'll be hearing something about that.
Yeah. Wow.
Other questions?
Maureen, I had a question.
Sure.
Do you know why the the window is so wide as far as 1 to 31 days of a suspension. That's kind of a big, you know, potential.
Like this, like 1 or 7 or 30.
I mean, it seems kind of like 0 to 100, you know? Is there a reason why there's so much variability?
Yeah, so I think I wasn't around when that, you know, those policies were adopted at the state level, but I think that we all feel, you know, someone could make a mistake. So we're not penalizing the stores heavily for the first sale, going back before the new law. And that, but if they sell twice, that deserves, and finding them $100 or $200 was not really getting their attention. But if you suspend their permit and they can't sell tobacco products for 7 days, that really gets their attention. So I've actually never had a store that sold a third time in 3 periods, in 3 years. So never hit that. They'd be really clean to get through, you know, to the 3rd year, and then it starts over again. It's a first violation after 3 years. So the suspensions really get their attention. So I think that's why the longer suspension applied to the 3rd sale. Does that answer your question? Or maybe not?
You know, in my mind, I would think it would be 1 day for the first, it would be 7 days for the second, it would be 21 days for the third, like period, end of story. I mean, it seems like with this law, you have the option of fining somebody 17 days if you feel that's appropriate.
Only for the, oh, I see. Oh, only for the first, yes, only for the first violation of a sale to minor. Is there any room at all? In the other violations and in the other second sale, 3rd sale, there's no room for the board. It's set in the state law. So that's the only one with any decision for you guys to make. And
Unless we want to go higher or stricter, right?
yes. Well, yeah. Oh, if you write it into your regs, yes, if it's a
Right.
regulation, right. If you don't change your regs, you have a choice, 1 to 30 days, first sale to a minor. Yep.
I mean,
You
That
could write new regs that say every first sale to a minor violation gets a 10-day suspension, whatever you want.
And then what about the second sale? Is that automatically a 7-day?
Yes, that's state law. And also it's written into Wakefield and Melrose's regs now anyway. You have in your regs right now, both Melrose and Wakefield, you have 100, 200, 300, 0 days, 7 days, 30 days.
Okay.
But the state law supersedes that. So that's why it's now 100, 1,000, 2,000, 5,000. And the new wrinkle is that 1 to 30 days for first violation, 7 days for second, 30.
Okay.
30 for the 3rd?
30 days for the 3rd violation. So that remained the same as it was and the same as your regulations currently have it.
Thank you, Maureen. That clears it up for me. Thank you.
You're welcome. I know it's a lot. It's been a lot to be trained on. It's been a lot for stores to absorb. And now that, you know, I've done presentations to the boards before, you know, pre-COVID when this law was just passed.
Yeah.
So then the law was passed and then boom, you know, 2 months later we were in
doing it
COVID.
again.
Yeah.
Yeah.
So we, you know, presentations were done, but we haven't really like worked on it and lived it like we are going to now. And there are a lot of provisions.
So Maureen, if you ever do a timetable PowerPoint, because I know you're presenting everywhere, it would be really cool just to sort of see where we were a decade ago with our regs, what we tried to do, because I believe there was a point where we, you know, we tried to make, we did an awful lot of things where we made Melrose and Wakefield align just to, you know, keep it straight.
No, I didn't even mention permit cap. There's,
Oh,
I didn't mention cigar minimum price. So these are not state law. These are local regs. Both Melrose and Wakefield have a permit cap, number of stores that can be permitted, and both have a cigar minimum price. Some years ago, young people were buying a lot of the pink and purple foil wrap flavored cigars, and we wanted to find a way to reduce that. And so the way was a minimum price. So now any single cigar in Melrose or Wakefield and many other communities, but not state law, any single cigar is a minimum price of $2.50 plus sales tax. any multi-pack, doesn't matter how many, 2-pack, 3-pack, 4-pack, 5-pack, whatever, any multi-pack, minimum price of $5 plus sales tax. So yeah, you've done a lot, and in different
Yeah,
years.
it would be like I'm
You're always
envisioning.
trying to
Yeah.
catch up to the industry. The
Yeah.
industry would do something, we'd find out about it, and we'd try to find a public health reg that would help control access. So yeah, over time, we have had a lot, in the last 10 years, had a lot of changes.
Well, if you have the opportunity to present at some public health,
Yeah.
and you've
Yeah.
done that, you've done that PowerPoint, just shoot it over, because it's
Yeah.
really hard to keep track of what we keep doing.
Oh my God, it
Oh my
is.
God, I thought, it's like
Yeah.
Groundhog Day. So, well
No,
done.
I got an inquiry from many of my colleagues did, but from the University of Utah, they're doing a study on the impact of cigar pricing policies.
Mm.
So they wanted to know, when did Melrose pass the cigar minimum price? When did Winchester pass this? I had to go digging through to try to, because it's all different dates. None of you did it on the same day. It's all different dates, and there are a lot of provision changes. And kudos to the boards for doing that. You've really done a great job. And both these communities have been leaders in the state in terms of adopting new regs. And I know you guys are Board of Health members, you know this, but local boards lead the way. And when enough local boards do something, then the state takes notice, with one exception, and that was the vape ban. The state jumped in, and Governor Baker did a vape ban. I think it was the summer of 2018 when we started having all those severe illnesses, respiratory illnesses, and deaths,
Before COVID.
and didn't know what it was. But people they'd had some vaping history. Now we don't know what they vaped, whether it was CBD, nicotine, THC, but Governor Baker stepped up and did so. But other than that, basically local boards have led the way, and then the state has followed.
So if we have, I know from time to time, I don't know, Elaine, if anyone's approached you, but we always get calls from students to do internships who are getting their master's in public health.
Right.
I would stick one of them on a history.
On this project. Yeah, absolutely. I would never.
I don't want to make you. So if an intern presents themselves.
Yeah, it's a good little, I'd like to see it in all my, all the communities.
It could be a publication.
Yeah.
If I get one, Maureen, I'm going to be calling you.
Yeah.
Thank you, Maureen. For those of you, poor Maureen came into me with all this, and I'm sitting there going, you better explain that again, Maureen. And it is very confusing, and I think she does a marvelous job. And I'm so glad, Maureen, you could be here with us tonight, because I couldn't explain it, because no matter how many times I read it and I talked, I got more confused myself.
And believe me, Elaine, I needed my notes. I can't even remember all that. I have 2 pages of notes. So, but I will send my bullet points to Elaine, and she can forward them on to all of you. Nothing you have to memorize. You can always call. You can always email me. And if there are any store appeals or store complaints or whatever, as you people have served on the boards a little longer know, I'm available to come to board meetings and, give the scenario of whatever happened. And yep.
We're
Thank
hoping.
you.
Thank you, Maureen.
Yeah.
Thank you all very much.
Thank you.
Thank you.
I'm glad you all could do this tonight, because I really felt that this was something that was very important. And I said it to Maureen, and I said, but I need you there, Maureen, because I was too confused. I really was. I had myself confused. You can ask Cindy. I had Cindy confused at one point too. I reread our regs. I was doing everything, rereading letters, and I finally said, that's it. She has to come. I can't do it. No way. So.
Always a good
Well, I
idea.
guess we go on to the health director's report, huh? Is there a health director here? Wow, they're still here. Still here.
Before we leave
Take
this,
note.
How
Huh?
are you
Elaine.
doing, Elaine?
before we leave this, are we making a motion tonight? Accept
Oh.
these and,
Oh,
I
thank
mean-
you, Maureen. Good point.
To
I
what?
mean, before we leave this, are we making a motion tonight to accept these regulations and firm it up. Personally, I think if we're gonna do it, we should do it as of almost immediately because the fines are going out.
It's up to you if you want to do it or you want to wait till, your next, I know this meeting was kind of set up to be, kind of informal. But remember, if you do make a motion tonight, what you're making is to make it in line with the state guidelines. If you, feel that that's imperative, then go right ahead because Maureen's out every day working.
And by the way, we have the wording, if for any boards who want to consider lining their local regs up with the new state law, we have the template, we have the wording for all the different provisions. So we can, we can send that out to both
So then
Melrose Board
probably
and
what we need is another, so it's the law of the land no matter what.
it's law. Yep.
Yeah.
So we,
Yep.
anything happens, Maureen says, yep, this is state law. And they can say, yeah, but our Melrose laws, and you're like, it doesn't matter. State law
takes it.
proceeds.
Mhm.
It's
Yeah,
just,
state law trumps local regs, and the only wiggle room at all is that 1 to 30 days suspension on the first violation of a
so
sale.
that's
to a
the
minor.
sticking point
That's the
whether
only
or
one,
not-
yeah.
is whether or not, do you need guidance on that now or? are we-
Not tonight. This is what would happen. So I'm actually going on vacation for 2 weeks, so I won't be doing, don't tell anyone, but I won't be doing checks for 2 weeks. But yeah, stores can do whatever they want. I'm not checking on them. The FDA is going to restart their checks though. That's good. So if a store sells and, and they get caught, they're in violation. It's been observed by an agent of the board, which I am. I'm an agent of both these boards. So if a store gets caught, they get the fine that is in the state law. If it's a first violation of a sale to a minor, then the letter that Elaine sends out will say, on such and such date, such and such a time, you sold such and such product to an 18-year-old, an underage, we don't see the underage, trained youth buyer, whatever it was, under the supervision of the tobacco program. And that, according to this law, we state the law, is a $1,000 fine made payable to City of Melrose, Town of Wakefield, such and such address. And you must pay that within 21 days or appeal it. When we say, if you have a grievance, and remember, when we say appeal, they're not appealing the amount of the fine to us because they can't. They're appealing the process. Was this a valid, were they entrapped in any way? We can't do entrapment, just as an example. The youth that I use cannot wear a hat, sunglasses, hoodie. They're instructed to dress the way they would normally dress. They can't beg if a store says, do you have an ID? And the kid says no, because they won't have one on them. They can't carry one in. Then the transaction ends. They say, okay, and they walk out of the store. They can't say just this one time, it's for my mom, I'll bring my ID the next, they can't say anything like that. That's considered entrapment when you're trying to talk to someone. So these are trained youth. So the fine stands, and that will be in the letter. And then the letter will say, and you will be notified by the Board of Health in writing about your suspension. Because then this is what I envision, unless you decide everybody gets 1 day or everybody gets 3 days, I envision that then that would come to the board. So the fine thing is in place, that check should be coming in. But then your next board meeting on that agenda would be so-and-so, first violation, you have to decide the length of the suspension.
And that
And once-
suspension, Maureen, doesn't have to come within the 21 days
No.
like they pay the fine. It could
That's
be
right.
up to, if there was something, an emergency or something that happened and the board had to cancel a meeting and reschedule it, it might be up to 60 days
Sure.
and that won't matter. Okay.
Yep. They'll be on pins and needles, and they'll be nervous because they won't know if they're getting 1 or 30 days, but they probably won't sell in that period.
Right.
Yeah.
Now, you make a good point on deterrent. If we write in a, in a reg that they're all going to be 1 day, people are like, oh, we can live with a day. So maybe
Yeah.
I'm not gonna like make. people
Yeah,
do it,
yeah, good,
But
good.
maybe there is a deterrent level in how uncomfortable that is.
And they could sell a second time.
I want to
In
think.
And
that
they could.
Yeah.
In fact, for every sale to minor violation, we have to go back, I can't remember it now, I think I have to go back within 30 days or 60 days and do another check.
Mm.
That triggers, a sale triggers more inspections, more frequent inspections and additional compliance checks. So they could, weren't you right, Laura?
Well, I'm just thinking, you know, at first, I think on first pass tonight, we were talking about, yeah, why don't we just make, you know, things more uniform and make that part of the reg? And now, as you're kind of describing the process on the store side, I'm like, I want to think about this.
Yeah, maybe we should think about it, and we could maybe consider discussing it at our next board meeting.
I think it is something that you have to really think about it, because even if they have that time, most did send in their fines right away, even though they were high fines for them, for some of them. You know, their businesses have just started picking up, and, you know, then they turn around and say it's 30 days and she's gone back in. It could be the day of the board meeting, and that night they could end up with their second time with the 2,000 and
Then it's all
bingo, a fine, you know?
It's a little more complex than we're used to, but
It is.
again, I think the state legislature did a good job making a really, really comprehensive bill to try to help control this.
My personal feeling is I don't think their fine should be based on whether they pay their fees on time or whether they pay their permit fees on time. I think the tobacco sale should be totally separate from anything else. Or any other, like, I don't know, anything else that they're doing.
I agree with that.
I don't think it should be contingent on, you know, whether their check arrived in time or whatever.
Yeah, I was just using
It should
that,
be
you know,
totally-
Yeah, we were just
some
using that as
communities,
an example, yeah.
some communities have what we consider bad stores.
Yeah,
And so a lot of things go on in those stores,
Mhm.
and they, you know, have been found selling products out of the back of the store and so on.
Yeah.
So I was just, maybe that wasn't a good example, but just mentioning, you, as a Board of Health, you might want to look at the totality of that store's presence in your community. And
see, I think that should be a separate issue personally. I think the tobacco is one issue and in and of itself.
yeah, that's,
You know, I
one-
agree with that, because if somebody's really bad about managing their dumpsters and,
Yeah.
you know, bring that into the fold, they're not necessarily gonna do better on the tobacco front, and that's really what we want to do.
Yeah,
So I kind of agree with keeping them separate, if the goal is really to keep these products out of young
so
people.
some communities do have a regulate, I'm not promoting this, I'm just letting you know. Some municipalities have a regulation that says, if you don't pay your fine, then your tobacco license gets, it gets suspended. You don't have a tobacco license until that fine is paid. So I think there is some cause in some communities to kind of tie it all together, because what we're looking for is stores to be compliant, whether it's the right temperature of their, you know, the water where employees wash their hands, the right temperature of the refrigerator where the, you know, we're looking for stores to be good, store owners to be good merchants in our community. So I think that's why some communities do look at and that might be why the 1 to 30 days is there. You have more leeway to put pressure on the store to, otherwise we could, you know, it could be a fixed number like we used to have. But certainly that's for the board to decide.
So Wakefield, you want to wait till your next meeting? Is that the gist I'm getting from you?
Yeah,
Just leave it. We'll go
And then,
according
you
to
know,
the state law.
and it would be nice if Maureen forwards that,
Yeah.
the kind of bullet
Yep.
point to you. I'd kind of like to digest that a little bit more. And we can
Okay,
talk
sure.
about this in August.
Okay.
I'd like to suggest that for Melrose too, because it is, even the more we're talking about it, you know, all these other little caveats come along, so.
Exactly. It's
Yeah.
not so black and white or just so
Yeah.
cut and dry. Yeah, yep.
So we can talk about it again at our next meeting and.
Hmm.
This is already happening on a statewide level as of when?
months ago.
What'd you say, Frank?
Already happening on a statewide level as of when?
When was the new law, the date, Maureen?
So some elements of the new law, Act to Modernize Tobacco Control, were effective 1/1/20. So all the insurance provision, the benefits provision, I forget what else was in that. The menthol ban was separate. The menthol ban was effective 6/1/20. And the reason for that was the bill was effective 1/1/20, except for the flavor ban. And that was to give stores time to sell down their product.
Mhm.
So they got essentially 5 months to get rid of the flavored products that they have.
And that's when the fines went in?
I'd have to look, Maureen, I don't have it in front of me, but the fines might have been effective 1/1. But the flavor ban was effective 6/1 to give those stores a chance to get rid of all the flavored stock they had. So if they had tin cans of spearmint chewing tobacco, they had 5 months to sell it off, not order any more from their distributor.
But this was all last year, 20.
20.
Yeah.
Thank you.
Is there any other questions for Maureen or anything else?
Great
No?
job.
Oh, thank you again,
So
Maureen.
thank you, guys. I'll sign off and leave you at your, whatever's next on your agenda.
Thanks.
Have a good summer.
Thank you.
Thank
See you
you.
tomorrow
Vacation.
Yeah, see you, Elaine.
in the morning. All right, I guess the director's report is next. I'm looking at the agenda. I'll try to go as quickly and try to explain as much as I can. I've been in the position for the interim director since June 1st. That was a Tuesday, by the way, in case you want to know. The staff in both communities, you should be extremely, extremely proud of them. They are a bunch of very hard working individuals and adjusting to changes. I mean, they lost a director. We have a new clerk, a new public health nurse. And it has been, hard to do things because everybody runs the place different. And as I said to them, it's different. For me, it's a different type of health department. And, I do things one way, so I had to make my suggestions, just make a few changes here and there, but they are just the most hardest working people I've ever seen. We have a new nurse, Melissa Lowry, who probably, hopefully, maybe will come to a fall meeting for each of you. She's been very busy between camps and doing the flu and catching up on a lot of other things. Our inspectors have just been straight out. Coral and Ivan do not stop between the food, the housing, and other complaints. Coral has been very, very helpful with me, helping me to tie up some grants that had to be closed. Our clerks, Cindy is the senior clerk now and taking care of everything. She's phenomenal. She just does it. And Denise is adjusting very, very well. And our two clerks, I think we're such a role model for our regionalization because the two offices just constantly, we go back and forth and helping each other. The grant staff have been all of them have done their, completing, including Catherine and everything for the year. We are presently interviewing for a full-time substance prevention coordinator here in Melrose. That was recently done in the last few years by a grant, and then was a part-time thing that they were doing in the schools in Melrose. That has now been changed over to a full-time city job. It's a line item in the budget. And we have started to interview for that. Today was our first day doing that. We still have the full-time regional grant person for substance abuse. Liz is now out of the Medford Health Department, but she still is working with us. She's phenomenal. She's another one. I miss her not being there now. As of July 1st, she moved her desk. Want to bring you up to date on the big grant that we have. You know that we were awarded the Public Health Excellence Grant, And that is done, wrote that up, and that was done through our Mystic Valley Coalition, which consists of Melrose, Wakefield, Malden, Medford, Winchester, and Stoneham. We will have the town of Wakefield is the lead town who will house them, and they will be employees of the town of Wakefield. We will have a grant coordinator who will oversee the grant and the 2 other employee grant people. One will be a full-time inspector, and the other one will be a part-time communication person. They will all be out of Wakefield. The coordinator will be right in the health department. The inspector will travel as needed between the communities to assist in all of them. And the communication person may even be done remote, because they will be working with all the communication people in both cities, with Jen in Wakefield and with Brianna in Melrose, who are 2 really phenomenal people, full of a lot of energy and very, very talented. Positions are now being interviewed by the directors, all the health directors and HR here in Wakefield. And we hope to have those like put in yesterday, because it should have been like almost yesterday, except for it really isn't yesterday, but I pretend it's yesterday. So it's not easy. I'll tell you, I'll be honest with you. We have 6 positions to fill between the 2 communities. We have the 3 grant people in Wakefield. We have a school nurse, the substance prevention in Melrose, and we have the lovely director position. And because of one thing I've noticed in my short time is that the grants, there are a lot of grants, and it is extremely confusing to me. And I've been on the board, so I kind of have a little bit of an in here and there. But Kara and I talked about this, and Catherine, and Kara Showers has developed a plan that all the grant positions will submit a report to both boards quarterly. And that way you will be able to take a look at them. You'll know what's going on, what that grant is doing to your community, and you'll get an idea of what these fabulous people with these grants are doing. And the position for the health director has been posted. I will resend you the pamphlet on it in case you do know of somebody. It is on LinkedIn, and I believe it is on the Melrose. It is on the Melrose website. And I believe it's also on the Wakefield website. The Jen from Wakefield, Jen McDonald, the communications did a fabulous job on this like little pamphlet all about Melrose and Wakefield and the health department. So we're looking. So hopefully these 6 positions, trying to fill them as soon as I can before I have to leave, which is September 3rd. Yes, that's my contract, September 3rd. So we're looking, and I'm very positive. I know there's somebody out there that's the right fit for the director. I love being with them. I've had it's a phenomenal experience. I really enjoy it, and I enjoy working with the boards, but I don't want them to get too used to me because I'm so nice. And that, a few things I've said, hey, I don't go that way. No, we got to do this, do it this way and that way. But the both staffs have been so great in suggesting things on what to do and talk it over and implementing some new things to help them. Our Inspector Ivan in Melrose is going to serve they're going to be filming a movie in Melrose. And he's going to be helping with all that. He's going to be on your new styrofoam committee. Coral, who goes between both, has been a phenomenal help in getting this excellence grant up and helping with the other grants. So we're really trying to get them to be, I'm a little bit of a cross trainer. I like everyone to know everyone's kind of what everyone does, so that in an emergency, at least you know where to go or who that resource person is. So that's what we're trying to do. I'm trying, and I promise I will do my best to get you the best director that fits in there. Because then, and I'll be the one to blame. I tell them if they just hire anybody and they don't like them, not to say, well, that was her fault. She was, we'll see.
Elaine, could you explain a little bit about what the excellence grant entails?
What does it entail? That's very good question, Maureen. Total confusion. It entails to have a regionalization and to have these people available to help and assist in the regions when needed. The grant coordinator will be one that will evaluate a community, see what they need, be a resource person, help with different things like if they have an inspectional background, to know all that. The inspector will be a backup and an assist to the communities, because when you look at all of these health departments, they just don't. The staffing is just, I think we've learned from COVID. Okay, I think we've learned from COVID. The grants are a good amount of money. We had 350,000, so there's plenty to cover for training, for positions, for equipment, for everything like that. And the communication person will also work along with the cities and towns in getting those messages out. I just did a small, did you look on your Melrose? Go on and you see all about the mosquitoes. I did a little PSA for them. So we have something out for that. And that's what we're trying to do, is to work with them. So these communication people will be the key to assist in what has to be done, doing that write-up. A lot of things have come out from COVID. I'm a big educational type of person, like writing this particular PSA. You have this on file. It's mosquito season. Bingo, you go, you pull this up. If there's a big change, you can change it. If not, bingo, goes on your website. You can make a flyer about it, things like that, you have to kind of have. And these, communications people in an emergency are going to know how to get that message out. To what we need and as much as you need. It's communication is the big thing. And that's a lot. And we're still going from communication from COVID. There's still so many people. And as Coral brings up a very good point about the lottery for people who have been vaccinated. There's like 4 million people that have been vaccinated, but only 1.2 million have registered. So if you want, make sure you get on that website, because you got a good chance of winning that $1 million. Unless they pull my name before they pull anyone else's name. I'm not sure.
Then you won't be there until September, right?
What? Yeah, no, I'd still stay. I'd fulfill, because by the time I get the money figured out and what I was really going to do with it, right? But that's the thing that we're saying in public health. We've been saying it for years and years. And I'm sure my predecessor was the same way. You got to make that time. And I think this excellence grant will help to aid a lot of places that are kind of lacking. And it will get everyone up in this coalition to up to par with everyone else too, hopefully. And I believe this excellence grant is ours for 3 years.
Oh, good.
With the possibility of being renewed. And I think that the success will be shown, and I bet you will be one of the ones that they will see the success in it, with the communities sharing the services.
Awesome. Thank you.
I don't know, any other questions? We don't.
Speaking of mosquitoes, so I'm assuming that the round, with all the rain, so there was supposed to be a round of spraying last night and then tonight.
Right. Yeah, he sent an email today, but he didn't say if tonight was canceled, because the thunderstorms, from what I understood, were on the South Shore, but they're doing them. They're not here yet. Yeah, so maybe we might make it, but I know he was doing them. I think we sent out the information on that. Yeah, so hopefully, as long as the weather, but the thing is
did we get, because I feel like this is a little early in the season, but I'm not surprised because of how much rain we've had. Have they been giving you any trap information in regards to?
Nothing. We haven't gotten any trap information, but he thinks that within the next 3 weeks, we may start to see more because of all the rain. And this is the first round of everything. So yeah, it should be an interesting mosquito season. You know, so we have to go back to the prevention. That's all, you know, don't go out, wear your clothing, don't go out after dark, you know, use your repellent, make sure, and I will get the little thing I wrote up for Melrose. We just got that on their website, is to get it over to Wakefield this week and get them to put it on too.
And then Wakefield has, I'm assuming, has stopped doing the bi-weekly or every other week kind of leadership COVID call. I have a feeling that those are going to have to rev up in the fall. Anything?
The COVID with the state was canceled this week. And the COVID call with Wakefield, I haven't heard. I thought it stopped.
Yeah, I think that
We'll
too.
be
I'm just
picking
thinking
it-
it's gonna
Picking
pick up.
it back up very, very soon due to the variant and the cases that have developed even here in the state. But the big thing is still trying to get people vaccinated, still trying to. And if you look, there was a nursing home down in the Barnstable County, down towards the Cape, that had 55 residents, I believe, were tested positive, and 9 employees, but they all had been vaccinated. So they have like really mild symptoms, and some had no symptoms at all.
Right. So
So,
thank God, but that's our next thing, is sort of, you know, how do we respond to that? And
yeah, we've been doing a little bit more, networking with a lot of other health departments and our coalition, because now comes the big thing as to what DESE will have for school.
right.
What are they gonna come out? Are they gonna come out with yes for mask for all ages? Or if they say, as they say now, over age 2, the CDC recommendation is if you are over the age of 2 and you are not fully vaccinated, then you're to wear a mask.
Yeah.
So, and I think more and more, I locally have seen a lot more people out with masks in the
Yeah.
community.
I feel like that's true.
Yeah, so,
Yeah.
and that's fine. Even if you're vaccinated, I've told people that's fine. It's your choice. You can do it. There's nothing wrong with it. And flu season will be coming. So we'll see how that goes this year. That should be interesting.
Mm.
So we'll see. So
Elaine, are we vaccinating at the Victorian Fair in Melrose?
Okay, good.
we do plan on it, providing if the vaccine is in.
Yeah,
Yeah, but that is it, because there is a date set for that already. You want to ask me? I can't quite remember, because there's one thing in Melrose and one in Wakefield. There's a couple of events coming up, but any events, as soon as flu comes in and we have a definite idea, we haven't got, I mean, it's usually the first week in August, we start to hear things and we start to get our BISs from the state, and we start to hear a little bit of things, and then, you know, promises of shipments, but you can never count on it until it's
Yeah.
right there in front of you in that box.
Thank you.
Yeah. Any other questions?
Great
I guess-
job, Elaine. Thank you very
Yeah.
much.
Yeah, thank you people for staying on the boards and giving us support. I know I have some friends somewhere, I think.
Well, yeah.
I don't know if you will have to have meetings in August. If you would like, I think you probably should set a date for it, just to be sure. Pick something, because we don't know what's coming down the pike in the next couple of weeks.
That would be the 18th, I think, for us, Laurel.
Okay. 2 days before. I'll be like crawling to the finish line. I have to have everything in on the 20th. 18th works fine for me.
Okay. Aileen, is that okay with you?
I probably have no life. Where am I going to be? Yeah, I will be. I have, my husband's having surgery again, hopefully.
Oh,
Oh,
Yeah, and number 4 in 13 months, but we're waiting. We're going through intense testing for the next couple of weeks. So I'm hoping that week, if it goes right and there's no COVID, maybe he can go to rehab this time. And the 18th, I'd be a free person, maybe. I don't know, but that's fine with me. I can always, scramble my schedule at night usually. Melrose, what do you want to do?
Frank, what are we, the second or third Tuesday usually?
Yeah, I think we'd be on for the 17th, I believe.
Yeah, is that too much for you in one week, Elaine? We could,
No, it's my second or third night this week, so what, come on, what else do I have to do at night? There's no new program starting, unless that's the premiere that week.
then we'll all cancel.
Yeah. The only other thing is, where we are going to be having the interviews for the director. The last time we had somebody from the Wakefield board and somebody from the Melrose board, along with their two HR person and the director to do the interviews. And we'd like to do the same. So I'm not sure who from what board is interested. We tried to do them, unfortunately, it ended up during the day last time. I don't know, and it was on Zoom. The first one was on Zoom. I think we may go to that pattern at least this time. And then the second one, when it's final to come in, they usually go into Melrose, because remember, they are a Melrose employee, and that usually will be in person. We have been doing actually our interviews for what we're doing now. We've done in person. So, but I think that one we would be able to do on Zoom first. So I don't know if you would like to do it, if you would kindly email me or let me know at least by the end of the week, because we have some applicants and we'd like to start to do the review and pinpoint it.
Wondering if you should have HR reach out to the board members so that you don't have to get tangled in schedule bingo.
Oh, they'll do all the scheduling. They send it out. Polly did it from Melrose the last time, which was we all looked at. What we did was they sent those on the review committee, the applicants, and then we went through them ourselves, sent in who we thought, should be interviewed. And then from that list, it was taken. And then there was a email about the date and the time. Am I right, Carol? I'm trying to remember. And then we just, picked them and we got the people in, and we did I think we did a couple of days, but we did them like two or like at least three at a time.
They were kind of back to back, it seemed.
Yeah.
Which was kind of the problem I ran into, because it was like a quick turnaround. So if I had patients scheduled
Right.
the next day,
That's what I'm thinking, the same thing.
it was
Yeah.
tricky. Unless there was a certain, we identify a certain time that we're going to do the interviews in advance, but that's also tricky.
Yeah, it
Yeah,
is.
no,
It really is.
Evenings are always, I think, a little easier if the applicants are willing for that.
Yeah.
And the Zoom went well. But I'll tell you, after doing all those Zooms and doing these in-person interviews, wow, what a difference. It's so lovely to see people in person, but to get that vibe from them, you get a different vibe. And I think you're able to get a lot more out of them. They're able to speak a little bit more. I figure on Zoom, I think they're always worried about what's in the background. Is there going to be a noise? What do I look like? Whereas they're in person, they're fine. They're sitting there, they're relaxed, and they can talk.
Well, we could do in-person interviews in the evening, right? I mean,
maybe, yeah.
It's a flipped model. So HR, so as board members, we tend to be a bit, we all have other jobs and we tend to be available in the evening, but HR is available in the day, unless, so it's like you have like, say I'm saying, Candace, like we have conflicting schedules, because it's like the people who are paid, who are actually responsible for hiring this person, we're like the consultants, and it's like it's a flip time, because I might be able to offer Mondays only. So I don't know.
Yeah. I will mention
Lots
to
of
them,
different ways to do
I've
it, like-
seen, a couple of the HR people have to come to night meetings with council, so,
Yeah,
you know, they may be willing to do it. And it all depends too on the person being interviewed. A lot of them seem to have time restraints sometimes, you know, they're, you know, want to have a Zoom when a time or an interview when they really are free, so, but I don't know, but I'll mention that to the both HR tomorrow
Okay.
to see if they're open to possibility of being a little flexible.
Well, the only benefit of Zoom is that there is more flexibility, I think, because,
Yeah.
you know, it's easier to devote an hour to a Zoom than, you know, the time it takes to get.
half-hour travel, yeah,
Yeah, yeah.
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 And the other thought I had is what about maybe doing like having the board members be involved in the second interview phase? Like, is there a way to maybe, you know, sort of weed out those people in the first interview process and then have us, you know, be available for the second interview? That seemed to be more lead time, maybe we would, it's just a
Yeah,
thought.
the second interview was, usually after we did that one interview with us, we made the decision after all of them as to put the candidate forward, and then they went to the mayor and HR. Yeah, he did the final interview, and that was done in person. That wasn't Zoom, that was in person.
Oh, that's good. Yeah.
It was much better. So, but I will, let me email the two of them tomorrow and talk to them and see what they can come up with and tell them, you know, what they think.
I'm happy to appoint you, Elaine, to figure out who's your best predecessor.
Yeah,
Better.
yeah. I
I still
know.
believe you're the best judgment of this.
Yeah.
Yeah, well, it's difficult because I tried to explain one thing to people. You have to remember what the background is of your director. I was a nurse, I was an infectious disease, a vaccine, that type of person who I knew the food end and the housing end, but I went more in the housing than the food. You know what I mean? I had to learn a lot more. And if you have some directors that are environmentalists and
Right.
they're, you know, that's their expertise. So the thing has to be is that the staff that you have under you
Yeah.
know their job, can do their job, but can also interchange.
Yeah.
Do you know what I mean? They can cross-train. They know how to help. And so far, I have to say, both staffs and both clerks are phenomenal. They're phenomenal with doing anything for you, anything at all, and knowing something or knowing where to go.
It's good to hear.
And sometimes, yeah, I feel that it's, you know, today I just felt bad that I couldn't help somebody, but I had 4 interviews to do. So I couldn't help on something and I just feel so guilty about it.
No, there's no time for guilt.
No, tomorrow I'll just do something else. That's all. But I'll get back to you and see what they can come out with.
Okay,
I'm sure they'll have.
thank you, Elaine.
Yeah.
You're welcome.
So we were talking about having a date of August, whatever it is, 17th for Melrose, and is that going to be a tentative one that we'll cancel if there's really nothing to discuss?
Yeah, I would put it in as tentative.
And that's a totally separate issue from the interviews for the, that led to the interview.
Yeah,
That's
yeah,
a totally
no.
separate issue. All right.
Really, unless you want to be the nice person that volunteers to do the interviews, Frank.
Well, I actually did say to Carol Ann, you know, if we're both sort of, you know, she's the first choice, then I'll be the alternate, if you will.
Yeah.
Can't make
And
it.
we could,
Yeah.
that might make it more successful in terms of,
We make sure that somebody's there, one of us is there.
yeah.
Yeah, that
Right.
would even be good. Yeah, that would be wonderful if we had a backup. Yeah.
I think it's time for whoever organizes this just to do a doodle poll. Who can come?
Mm.
Yeah, I know, it's so hard, and it's hard. I mean, the last time around I was home, so it didn't bother me. I was here, you know, but now I'm not here. I'm in an office somewhere.
So does that mean the whole tobacco discussion is not going to happen until September, I guess, to follow up?
That would be my goal, Frank. That's my goal. But I can't promise that in seeing things coming in the last few days and trying to negotiate a few things here and there with some other problems and some other issues that have come up. So I would hope it would be September to give us time to just kind of catch up, get these people in place, and to possibly get the new director in and get them a little bit oriented to things, and then say to them, oh, by the way, you have 2 board meetings next week.
Mhm.
You know what I mean? Just, I don't want to just throw them in. My goal is to get somebody and at least be able to work with them for a week or so. I mean, you know, we could get somebody who is very, very experienced, who just has, and even trying to learn the lay of the land is difficult. You have to remember, you got 2 communities. So you got 2 different offices, but it's just phenomenal, phenomenal supportive staff. And that's the one thing that will help the person. Yeah, it's helped me not to go crazy, I think. I am crazy, I think, sometimes, so. You know,
Okay.
but
All right.
Okay, so
I-
till the
I'm gonna make a
17th?
motion.
you what? You tired?
I'm
Motion.
gonna make a motion to close the meeting for Wakefield.
Great. I second that motion, Laurel.
At 8:37 PM.
8:37 PM, July 21st, 2021.
7/21/21. Did
I'm in
anybody play
favor
that?
of my own motion. Roll
And-
call, Corville.
Does somebody want to make the motion to close for Melrose?
I'll make a motion to close the meeting at 8:37.
I second that.
And all in favor? Aye.
Aye.
Aye. Meeting is closed for Melrose.